I probably care a lot less about AI than most AI people. We have surprisingly little context. Before someone goes to the ED, before somebody stops taking their medication, hours in a day doing that documentation, and that's hours taken away from the time where they're with the patient. People have to repeat information that is already uncomfortable to begin with. The precision that we need to take care of a single soul. I don't think that's the work of an AI agent or a chatbot, but I think we can deploy the AI so that
Welcome to Healthcare Without Blind Spots. Incredibly excited to be with friend, colleague, fellow healthcare warrior, Shoshanah Brown, who is the Chief Population Health Officer at Popai. Thanks for being with me.
Thanks for having me, Trenner. Very excited to talk to you today.
Yeah, it's going to be a lot of fun. I like to say, these should and are easy, fun, good conversations. And what I love about sort of the opportunity to do this is share stories with people who are doing the really great work out there. You are chief among them. So thank you for joining. Shoshanah, one of the things that I think is so important in the conversations that we get to have, both personally and professionally, I talk to a lot of people about the concept of joy. When you think about joy, what brings you joy? What takes joy away from you?
I love this question. We should all think more about joy and
Yes.
feel more joy.
Right.
I think beginning with my amazing wife, who is a pediatric hematologist and oncologist, and spent her career taking care of children with sickle cell anemia in academic medicine. And then a few years ago, made a pivot to work on gene cell therapy for sickle cell
Wow.
disease. And so she's been working on those new therapies and the potential impact that they will have would just be transformative for a population that has really suffered
Yeah.
lots of pain over many years. So that's exciting. That brings me joy. Um, my kids, watching them grow, um, evolve into amazing humans who are resilient and funny and creative and keep me on my toes.
Yep.
Um, I think one of my favorite jobs so far, and I've had several, is has been coaching my younger son's soccer team. That was just
Nice.
completely exhilarating. Elementary school kids
Love
playing
it.
soccer.
Yeah.
And I think a passion for me that's been consistent since I was a young person has been learning languages. I love learning languages,
Nice.
and Um, this might be also a little bit of a superpower, kind of goes together. Just learning languages, I think, requires a kind of listening to people,
Yeah.
which has definitely been core throughout my career. And there's a real through line there. When I was in my 20s, I was a Peace Corps volunteer in Burkina Faso, West Africa,
Wow.
in a rural village. I was a community health worker, which is where I think my work in health and population health really began, but I learned a language called Moray, which is the dominant language of the Mossi Plateau in
Okay.
Burkina Faso. So very useful in that part of the world, less so outside. But I love listening carefully to people.
What a great skill set. And I would imagine, staying with joy, that ability to listen and therefore hear the stories that people share, is joyful.
For sure.
Are there things that you could articulate that take joy away?
Definitely. Um, Especially these days. I mean, I think, thinking about this at the macro level, one of the joy sapping themes, maybe always, but especially lately, is really for me around our collective inaction, where we see a problem, we know a problem, we might even understand and have resources to solve the problem, but we get into this kind of paralysis. And we all have limited time and resources, but um, I believe we can and should do better, and I try to do better. And Try to, like, keep in mind some of the wisdom and principles, from earlier generations to help remind me, um, uh, of the importance of, like, doing the work.
And can I piggyback on your on that for a second? It makes me think too that one of the things that really hurts me is the performative or the doing it for optic, the inaction, right? Or the actions that are driven for show. And it
Mhm.
feels like in healthcare, unnecessarily there can be too much of that. And part of that I think is because the work, like the real work, is so damn hard. And sometimes it's just like it's easier, right, to do small things or showy things than get in the weeds, right, and roll up your sleeves and figure out who to partner with, who's aligned and can actually go solve hard problems.
Absolutely. Well said.
I feel like you gave a lot of your B-side intro there. The Burkina Faso is awesome. Is there anything else like unknown like that folks would be surprised? There are probably lots of things for all of us, right? But that are surprising, like that you would share.
I'm a big, fan of women's sports. I don't know if that's surprising, but I get very excited about what's going on with the WNBA, with the
Yeah,
NWSL and those teams. I mean, sports in general. I also love the Knicks. I'm super into watching the World Cup. I got to go to one of the games,
yeah,
Haiti versus Scotland. Rooted
nice.
rooted for Haiti, but really appreciated the passion of the Scots.
The joy that has come from the World Cup and so many fans and cultures all here, like all around this amazing sport. I love it. I mean, I spend most of my days, I've worked soccer into most healthcare conversations now on a
Nice.
regular basis.
Nice.
Um, my wife and I watched the Spirit play Gotham last night in front of 43,000 people at
Wow. In
City
Queens?
Stadium. Yeah, they played and it was the second largest crowd for a NWSL game, which is
I
super
saw that.
cool. So yeah,
Very cool.
yeah.
Very cool.
We could probably talk about women's sport and soccer and other things forever, but I'm gonna transition us to maybe the work at hand. Um, and I'm excited to have this conversation. There's AI is everywhere, and lots of conversations. And for somebody who has come from the hardest work out there as a community health worker to what is right now the flashiest of all flashy things in healthcare right now in AI. Can you talk a little bit about the work and the why for you at Pop AI, the work that you're doing and why it's so important?
Mhm, I sure can. And, the first funny thing is I probably care a lot less about AI than most AI people, or maybe that's obvious, but what I see in the use case that Popai Health brings to the market is a real opportunity for the frontline workforce, in particular, the non-clinical frontline workforce, community health workers, care navigators, coordinators, care managers, social workers, all the folks working across the different like places in the ecosystem to really address the barriers, the real barriers that we know represent the reason people are healthy or not, healthy or sick, or on a trajectory to becoming more healthy or more sick. And so, in the case of Popeye Health, um, I, I feel so good about the use case
Yeah.
because I've seen this workforce struggle for so many years to manage the fragmentation. We talk about healthcare being fragmented on like on the clinical side, but on the social side, it's even the fragmentation is beyond. It's just um, it's impossible to connect dots to know where to find help, um, to put it all together in the moments that matter for the patients who need it most. Um, so I can pause there. But I can say that I see AI as a great enabler for this workforce. And what I love about Popeye is that we're keeping the humans in the workflow.
Yeah.
The care man we're not replacing the humans who do this work. We are much as we talked about when in the earlier like digital health
Right.
wave.
Yeah.
But I think at a whole new level, making it possible to do these jobs, because none of us can possibly hold in our minds all of the details or even most of the details um, of a person's life, certainly, and then certainly at scale, at the population level, the details that really matter.
Right.
Um, and so AI can help us to do that, and it can help us to focus on the care that we want to deliver, the empathy that we want to bring to the interaction, rather than being mired in administrative burden and documentation in multiple systems of record
Right.
that don't talk to each other.
I love that. I want to stay on it. And I love that we're on this podcast, Healthcare Without Blind Spots, which is a statement of hope, not a statement of reality right now. Um, and I think about sort of both the blind spot that the majority of those frontline non-clinical workers that you talked about. And I think, my mom was a social worker, and the reason I'm a family doc and the reason I do what I do. So one, sort of thinking about that workforce who has probably been a blind spot for lots of administrators or clinical professionals, right, as part of that. And then the communications that a vulnerable person, if we think of them as a patient, is having, right? And all the things that get missed, right, in the clinical conversations that are having. Can maybe just on that point talk a little bit about like examples or like what we've been missing for so long that Popeye can bring and shed a light on.
I appreciate that you're applying the blind spot kind of definition to both the workforce that's been neglected and
Yeah.
underinvested in, and also the patients that we're serving. As you know, but Popeye is focused on the underserved. We're partnered with FQHCs, community health centers, really the safety net. Our work has really taken off in New York City, though we're growing quickly because there's so much demand in these healthcare organizations to expand capacity, to do more with less, and that's where Popeye's coming in to really um, help stop the important information from the patient perspective and the frontline perspective from falling through the cracks. So, for example, um, before someone goes to the ED, before somebody stops taking their medication, before housing instability becomes full on homelessness or before somebody becomes unhoused, they usually say something about it, and they may mention it to the receptionist when they
Right.
walk into a physical clinic. They may mention it to a navigator who's doing a social needs screen. Like in the case of New York, we have, as you know, the 1115 waiver,
Yep.
which is really trying to screen the entire state at a very high level, very kind of aggressively and with standards for the first time using the same social needs screener. But that information might be picked up by somebody, documented into a system that never talks to another system, and certainly doesn't talk to, by the time the patient gets in front of a clinician or, God forbid, ends up in the ED.
Right.
Those pieces that come through a patient's voice in these different fragmented touch points, um, if we were to capture those insights and those details shared across an organization, we would do a whole lot better at early intervention and prevention. Because these are the details that we miss. Somebody says, somebody has a follow-up cardiologist appointment. They mention that their sister or their aunt their caregiver on whom they rely is going away, and therefore they don't have a ride to the
Right.
appointment. The
Yeah.
appointment gets missed. Popeye helps to pick that up, helps to orchestrate the information and bring the signal forward at the places and the times that really matter to drive the next best action for the patient.
I love that. And you know, you talk about the traction, right, and the need that's out there. Um, is it how universal do you think people, especially administrators and leaders, health system or health plan or other, like, do they all see it? Is it just, are we just at sort of the beginning where only a few do? Do you have a sense of like,
You mean, do they see sort of the potential value proposition of what Popeye
yeah,
brings?
like, do they really recognize that there is a problem? And then maybe as part of this, do they sometimes people recognize a problem and because they don't know that there could be a solution, they choose not to address it? Like,
Right.
yeah,
Right, I think that pervades as a just human response as we talked
sure.
about at the
Yeah,
beginning, the collective inaction, but what we're seeing out there, especially, within Medicaid where there's so much pressure, I mean, within our whole health sector,
yeah,
um, in terms of regulatory, financial, political, all the pressures that healthcare delivery organizations, that providers are facing. Um, I think there is, a clear there is a clear value proposition for the deep patient context that Popeye is offering
yeah,
to bring and put together. So, healthcare organizations, payer side, provider side, and all sides have a lot of data, right? We don't have a lack of data, in our sector, but we have a lack of patient context. We have a lack of understanding at how to stitch that data together to make meaning of it so that we can get to, a picture of the person, of their lived experience, so that we can act with that deeper context that Popeye is enabling. And I think that is compelling, and we are getting a lot of traction on that. I think we have surprisingly little context. You know, we have diagnoses, we have labs, we have pieces of information that live in different repositories. Um, but Popeye helps to bring it to life.
yeah. You know, we think about, let's say this is a former practicing doc, we can be egocentric, right? In healthcare, we will commonly refer to people as their diagnosis, right? The diabetic in the room down the hall, right, is part of that. And I think you know this. I could do this thing about how many minutes people are with their doctor, the 63 minutes in a given year, right? With a doc and NP or a PA. And God, what a tiny amount of time as part of that. And what the work that we do at Socially Determined too is trying to understand context, like the lived experience that somebody has. Now we miss it because we're still data centric in terms of how we do it for people. What's amazing is Popeye's ability, right, at that person level to hear their voice, like literally their voice, right, as part of these conversations. We forget, like, it feels like I don't know that we do. It feels like that we forget that we are treating people, that people are at the center of this, that they are the reason that we get to do the work that we do. They need us, right, as part of that, but it's for them. Sometimes it's just it feels like we do it to them.
For sure, and I think that's certainly true, like, in the clinical realm, as you've discussed from your experience, but also in this whole domain of the non-clinical, right? I mean, the social drivers,
Yeah.
that end up really, uh, reinforcing the disparities that we're all trying to avoid, like, problems that can be solved, a ride, help with a pharmacy refill or med reconciliation. Sometimes they're small things, but, when missed, they explain a lot of
Yeah.
the avoidable utilization and the cost in the system that we all know about.
Yeah. I would imagine that the frontline workers, like, it would be great for you to give some perspective there. A, having in your lived experience, as a community health worker from the time that you were 22, um, one, how they feel today becoming more participatory, right, in people's health and healthcare journey. Maybe 2 things. One, just sort of that perspective on how they feel it and their increasing appropriately increasing role in the healthcare. And then 2, be interested just practically the use of AI, like, how do they feel about this in those conversations and in that interaction with the patients that they're seeing in front of them?
Sure, great questions. Take the first one,
Yeah,
and I sort of can't I don't wanna speak for today's community health
sure.
workers, it's been a long time since I did that work, but I have been very close to that workforce, throughout my career. I think you know that, I founded and led an organization in New York City called AIRnyc, um which still exists in the Bronx. We started in Harlem, and we deployed community health workers to the homes initially of families struggling with asthma. Their kids were missing a lot of school. They were ending up in the hospital. We had community health workers first with no technology, just in the homes, but leveraging their lived experience, their language skills, their cultural humility to connect with families, provide education, bring them into care, address the social determinants in their lives, whether it was the air quality within their buildings, the pest management
Right.
intervention. I start with all this context to show you the arc. At some point, we tech enabled that workforce, and the first step was sort of tablets in the field that had Microsoft access on the back end, and we would cache the data. It was
Yep.
very clunky.
Yep.
But we had data, and though we were a small organization, the data that being data driven and tech enabled early allowed us to really have a seat at the table when value-based care started to take off, when Medicaid was redesigning itself around, the principles of preventing avoidable utilization,
Yep.
ED use, and admissions. So I think this latest turn of the dial toward AI for this workforce, again, is really powerful. I think, let's start with documentation. Um, Often community health workers are working in other languages, but the requirements of a state or states would be in English. And so there's translation or interpretation involved. And
Yeah.
so while trying to do a home visit or do a phone call or a bedside visit, there's a whole lot of brain gymnastics that have to go on between the conversations with the patient and the documentation in terms of how it needs to look in the system. So one of the things Popeye immediately does is eliminate that burden.
Yeah.
If
Uh,
we're doing the documentation, it's pre-configured per the requirements of the particular program or team. Um, Another thing is just managing like tasks and keeping all the different tasks in mind, whether it's addressing food insecurity or somebody needs medically tailored meals and all the different things that patients need.
yeah.
Popeye's helping the workforce keep that together without having to rely on human memory. There are a lot of sort of players in this space. I mean, AI, as you know, is taking off in the world or has taken off. And um, there's a lot of, I think, anxiety about that across many sectors of the economy, including healthcare. And that doesn't spare community health workers.
Sure.
I think one of the things that's immediately, exciting, gratifying is that piece about documentation because a community health worker, a care manager can spend hours in a day doing that documentation, and that's hours taken away from the time where they're with the patient. So that's on the plus side of the ledger. In terms of um, um, quality assurance and being able to level up the performance, I think it can feel anxiety provoking at first to know that listen, we're going to make this whole endeavor a lot more transparent so that we know that we're doing the right things for the patients in every conversation at
Yeah.
every touch point. And so that can feel, I think, daunting. But ultimately, especially in the environment we discussed, where, you know, Medicaid programs, whether they're health home or other chronic disease management programs that are so important for the population we're serving, those programs with HR1,
Right.
and all that that brings are under threat. And so I think there's appreciation at the level of the front line as well that we all need to kind of do more with less, be more efficient, be more effective, and not compromise quality. In fact, let's find the tools that let the humans do their best work. And that's where, I think the Popeye use case again is one I can really get behind.
Yeah, I think the central theme, and you brought it up now a couple of times, of not replacing, right, a workforce, but instead empowering and supporting a workforce, which that feels like the highest use of AI, right, in many respects, especially in healthcare.
Yeah, and that's not to say that there isn't a role for agentic AI,
Yeah.
for agents, taking off, workload that is appropriate and can be done by an agent. And there are pieces of workflow where I think that makes a lot of sense. But I like personally from where I'm coming from, I like the notion of helping people work at the top of their license
Yep.
or if there isn't a license at the top of their game,
Right.
to serve the patient.
Yeah. I love all of that. I also think about the impact. Like I think of every time you get to engage with a patient, a person, whether you think of them as a patient, a member, an employee, right, a consumer, right, it's a privilege. And it feels like so often we don't take advantage of that privilege to do sort of two fundamental things. Like, one, how do we listen? You talked about listening before. How do we listen thoughtfully? And then how do we share information as well? Like every single engagement opportunity, the privilege of being able to do that. I would think with Popeye, like just as you described, removing some of the administrative burden, the documentation components that an individual has to do, that their, I would imagine both objectively but also subjectively, their perception, both as a frontline worker and as a patient, um, engagement is going up. Trust goes up because if somebody is more fully, again, involved, immersed, right, in that is that, am I thinking about that right?
Absolutely, and that's another aspect I'm glad you brought up because I think that, um, building trust is everything, um, with the population that we serve, with anybody who's feeling vulnerable, who has a health challenge, or a social challenge. We have to build and maintain that trust, and like, the first time that I've seen a technological assistance for that reduces frustration on both the workforce side and the patient side. So, you know from working in this space,
Yeah.
the way we screen and rescreen people and the way
Yep.
people have to repeat information that is already uncomfortable to begin with, right?
Sure.
That
Yeah.
is already, information that feels sensitive and invasive, intrusive, causes, where there's stigma around it, whether it's about behavioral health or hunger or shelter. So the idea that we can, with a technological solution, or platform like Popeye brings, stop that or reduce that so that
Yeah.
people don't have to repeat themselves. So the question doesn't have to be asked a million times and the patient doesn't have to say it every time they're
Yeah.
having an encounter. That's a small but, like, really important improvement, I think.
I don't know that it's small. I think that's a really, I think that's a big improvement. Uh, I'm gonna shift, just sort of continue the workflow for a second, because as you're describing this and again, being able to connect an individual to a resource, an intervention, an internal program, and outside community-based program, a benefit that might be available, like, that's hard, and it's hard to do at scale, and it's hard sometimes for organizations to justify the investment in those interventions as part of that. Can you just sort of talk through both what's easy and maybe what's still hard right now about that, sort of the connection to trying to help mitigate the risk, solve the problem, yeah, support the person?
I mean, as you know, in healthcare, whether it's a large system, a mid-sized provider group, a payer, there are different stakeholders who are the sort of buyers of services or technology, and you have to sort of talk to all of them in their respective
Yeah, their
languages,
vernacular. Yeah.
in their vernacular. So, I mean, part of what we're doing is also, um, there's value proposition, there's a business case for it, a
Yeah.
strong business case, right? We can reduce missed opportunities to address, gaps in care, quality gaps. We can improve again capacity, and so of course the business case is there, and we make that very quickly because of the whole no margin, no mission
Yeah.
reality that we live in. Um, there are stakeholders that we're talking to or that, who are already partnered with who, they really just wanna talk about, patient experience, and so what really resonates is, people feeling less frustrated or, people expressing joy at being heard or,
Yeah.
getting their need met, whatever that need is, and it might not be the need on the care plan that the physician put on there or
Right.
the nurse put on there, but the care manager says, "This is important. This matters. Let's get this into the care plan. Let's work and take action on this barrier for you, Trenner,
Yeah.
your individual barrier." And so, there's the clinical side, and um, I think we have to tie all of this together. And I think we're really seeing a lot of traction because these are pain points that are universal across the industry.
I'm hopeful for like I believe in a social clinical care plan at a person level. I believe that we and I actually think AI is a huge part of this. I believe that we have the opportunity to think about all the different intervention strategies, opportunities that we have. That we have internal programs and people, case and care management, CHW, right? As part of that, we've got community-based resources, right, that can provide valuable resources and support for an individual. You've got, if you're on the payer side, you've got the provider who's seeing that person. So maybe in the FQHC, if you're on the provider side, they've got the payer who has benefits, right, in lieu of services on the Medicaid side. It's really hard to think, how do we do that at scale of actually creating a portfolio that's person specific, that meets both their clinical and their social needs. But I also think that that's possible. Like, I don't think that's a pipe dream.
I don't either, and that's what I mean about I suppose this is why I'm bullish on AI for this specific use case. It's enablement, in a way that I've been around for a minute, and I haven't yet seen opportunity like this to center the patient's voice in the whole sort of patient journey or in their experience, right? If we can bring in the conversations with the receptionist, with the pharmacist, with the social worker, with the community provider, um, tie it together and um, reveal what is most important to the patient at the center. I think that's what we've all been talking about for so long is like patient centered and yet it's been very hard to keep that patient voice and the patient perspective and preference and priority set in the center.
Right.
So I'm optimistic all over again.
Good. Well, this is why we're a bit crazy as entrepreneurs, right? Because we keep believing that things are possible. Like, we are optimistic by nature, and which I think is a wonderful, joyful thing for sure. And I do, I think historically, and I too have been around for a minute, like, we haven't had the infrastructure, both from a technical standpoint, from a people standpoint. It feels like so much of that has changed. And I don't expect it all, obviously, to get fixed overnight, but it feels that the building blocks are in place.
I think that's right, and I think, for those of us who have been around, have worked with, the limitations that and challenges we saw, say, during the pandemic, like, we saw such fragmentation, we saw such disconnection, um, and it made some of the problems we were trying to solve, like, they were
Yeah.
truly intractable. whether it was like getting masks where they needed to go, or making sure just essential workers were able to show up, essential workers, and that I think now, um, I don't know that, like, mission, like, that we're in a different place in terms of of the right people caring, from like a, like, humanities perspective necessarily, but I'm putting some faith that technology can just ratchet down the barriers, in some really important ways right now, and be in the hands of people who can use it for good.
And I'll double down on, and again, you said a few times, the patient context and the patient voice. It has been the missing piece because I think it's been so hard. Um,
Yeah.
and it's arguably the most important voice right at the table. And there've been great work by patient advocacy groups and other people, but it's not the individual patient. At the end of the day, everybody's journey is different. And so we have to enable everybody's journey. Like we have to be able to listen to everybody's story as part of it.
We do, and again, I think listening to the individual and then listening at scale so we
Yeah.
can identify patterns, we can predict risk better than we currently
Yep.
can. We can keep toggling between the population level and the precision that we need to take care of a single soul. And that's what we're working on. I feel excited about it. Yeah.
Yeah. I'm going to ask you one sort of future question. So fast forward just a few years, 3, 4, 5 years. What's what does the role, career, right, for a community health worker or frontline worker look like? What's different for them? What do you hope looks different?
I hope that we can sort of recategorize, um, the tasks and functions such that, like with any other role, in healthcare, they are able to use their skills, to build trust, to connect, right, to show up for people, who are often, the forgotten
Right.
ones, the hardest to reach, the people who we know need the most help. I don't think that's the work of an AI agent or a chatbot, but I think we can deploy the AI so that the human community health worker, care manager, care coordinator, um, can do the things that they do best. And in the future, I think we'll resort, recategorize, and reprioritize those tasks accordingly.
You make me hopeful. Thank you. Shoshanah Brown, thank you for the work you do, that Popeye does. It's really important. Deeply appreciative. And thank you for joining me today on Healthcare Without Blind Spots. So.
Thanks so much, Trenner. It's been a pleasure.